Claude, I appreciate your presentation. And thank you to Judge Diaz and our own Maria Villagomez for the work that they've done on CCDB. This, as was mentioned, this is the first time we've had a comprehensive plan, and it's exciting. Of course, we want to make sure we're doing it right. This is, in many ways, kind of a first step towards a very long process, but I only say long because I want us to continually keep up with it and be more innovative as we move along. It would be nice to say that this is going to eradicate domestic violence, but we know that this is a very long-term goal for us. There's a lot of things that this plan and the process brings to mind. One is, as we all know, we can't put public safety entirely on the shoulders of our police department. And so that's a big factor. We also, I think, all know that we can't arrest problems like these away. So I think that's what this plan is doing. It spreads the load across different departments, obviously from a public health perspective, adds community resources to address crime and violence at their source. It's a complement also to the micro hotspot strategy. So I see a lot of, just in the initial presentation, see a lot of collaboration, and that's something that's exciting to me because it can't be handled by one individual department. But there is still a lot of work to do in preventing violence. We should think of this plan as the first in a series of steps in crime prevention. And you mentioned a continuum. Of course, I would like to focus the most we can on primary prevention before the violence occurs. We don't want anybody to have to deal with any more violence than is already going on out there. But of course, we know it is. And so we have the secondary and then the tertiary prevention, which are also important. I think the strategy should continue. It should go deeper. Public safety is public health. Public health is everything else, right? Mental health, economic development, education, opportunity. So when we broaden our approach to public safety, we should put ourselves on a track to address all these things through that public safety lens. That's what I think this plan does. I think it's a really solid first step towards that. I have just a couple of questions. But Claude, I view the violence prevention plan as an initial phase of Metro Health, working with our public safety committee. However, I think a second step is necessary because of so much of our conversation has focused on mental health, not just in this room, but I think as a community. And we've acknowledged a lot of the work needs to be done to related to mental health and public safety. But I'd like to see some kind of mental health and public safety strategic plan created together. If there's something that we can maybe work on together to have that plan going forward. I know our constituents want to see that progress. So I'd like to see a plan for this strategic initiative coming up in the next several months, if that's something we can work on. I'm also, I think on slide 11, you mentioned, I'm a big fan of dashboards, so I think it's a good way for our city, our community, I'm going to slide 11 real quick because I think it's slide 11, to understand kind of a snapshot of what's going on. They're not able to all come and talk today at our public safety meetings or any of our committee meetings or even our council meetings. But a dashboard, I think, is kind of a one-stop. You can go and look at what's happening and the direction that our city is headed towards. So I'd like to see a centralized dashboard or a toolkit developed for the coordinating team to share data and evidence-based strategies, as transparent as we can be with our public. So my questions are, is data being collected through mandated reporting or through voluntary reporting? How can we make sure that we're addressing vulnerable demographics specifically that are more likely to incur violence but maybe less likely to report it, which is, I understand, and what I just said maybe contradicts itself. But my concern is for these populations that underreport, like people that are undocumented in our community, LGBTQ plus, special needs, people with special needs. They're not as likely to report violence. Is there a way that we're trying to figure out how to capture that data?
Thank you for the question. So I would say that there are different options to triangulate to at least have the best snapshot. So, for example, one of our priorities, we established an informatics unit at our department because we wanted to do a better job with our epidemiologists, our disease detectives, to see the patterns of disease or the disruptions that we're seeing in community. So we are at least going through this planning process to make sure that we capture the best data that are available. Sometimes there are lag times, and so we want to make sure that we're not drawing incorrect conclusions, but it's allowing us to at least shape the programs, see and understand the experience of victims on the ground. So just know that we have that team in play, and it's one of our priority areas in the SA Forward plan.
And Chairwoman, just to add to what Claude mentioned, and I would offer the work that we have done at the CCDB with gathering all the data that is available, not only from the city and the county, but also the many nonprofit partners that are working with the CCDB, with the goal of providing a more comprehensive picture of what's going on. We know that not everybody reports necessarily to the police or Burke County office, but they may be relying on nonprofit organizations, faith-based community as well. So that's an example of the work through Metro Health in the informatics division that Claude mentioned that we have done for the last couple of years and that we are expanding. And we can use that example also to address all the other aspects of violence, not just domestic violence, but the other violence that we experience, to try to provide our community a better picture of the extent that we see in our community.
Okay. Thank you, Maria. And so did I hear from that we are going to work with the county? So it brings to mind specifically the court system. There was a time when I was on the indigent misdemeanor wheel, so I was representing clients who couldn't afford an attorney. And so many of those clients were domestic violence victims. And even though at some point somebody called the police and they were in the court system, there were so many times when they couldn't prosecute or they had to dismiss a case because the witness would disappear, my client would stop answering calls because they got back together with the person or for whatever reason. There were a lot of reasons why they got lost in that system. So it just brings to mind, even when they do get reported, they're still lost. So you're working with the county to help collect that data, and then I really do appreciate working with the nonprofits, that they may reach out to the nonprofits before anybody else. So that's really savvy. Those are my questions.